Hi, this is Dr. Tranchitella. There are a few key things that are important to address when treating SIBO or small intestine bacterial overgrowth. It's important to get in there and to reduce the bacteria and to follow certain diets that help to reduce feeding the bacteria. But SIBO can often result from some other underlying cause. And so we have to think about this from a functional perspective and consider the process of what has to go on in the digestive tract in order for things to function properly. And the first thing is that we have to think about digestion in general. Is somebody digesting their food properly? Do they produce enough hydrochloric acid, pancreatic enzymes? Do they have good bile flow? Bile flow is really important in terms of small intestine and large intestine motility. And that can be where some things get really messed up, is that people are not digesting things properly from the get-go. So it affects your ability to break down your foods and to support motility through this process. Another thing to consider is other underlying infections. Because SIBO is a hot topic these days, people aren't considering, or they're bypassing doing just standard stool testing, looking for underlying infections. You can have SIBO and a parasitic infection, and they can present the same way. But if you only do SIBO testing, you may be treating the SIBO over and over again because you haven't gotten to the other underlying infection that may be creating the environment that allows SIBO to develop. So that's really important. Other infections may be H. pylori in the stomach, which can suppress the production of stomach acid, which can blunt the whole digestive process from the get-go. So it's very important to look for other infections. Also considering the presence of yeast, candida, can present very similarly to SIBO. So we need to make sure that we're treating the right thing. The other aspect of treating SIBO is really to support motility in the large intestine. If we're going in and we're trying to reduce bacteria in the small intestine, usually there's an overabundance of gram-negative bacteria. And when you go in with some antimicrobials, whether they're botanical or an antibiotic, you're going to release a lot of toxins from these bacteria. So you want to make sure that they have somewhere to go, that they get out of the body. So supporting motility in the large bowel is just as important as supporting motility in the small bowel. If people end up with loose, or their stools are backed up and they're not able to eliminate those toxins, they may generally feel worse. So we have to consider addressing the underlying functional aspects of what's going on in the digestive tract to be more successful in treating our patients with SIBO. This is Dr. Tranchitella. Thank you very much.